John Riggi has spent nearly 30 years as a highly decorated veteran of the FBI and now serves as Senior Advisor for Cybersecurity and Risk at the American Hospital Association and its 5,000-plus member hospitals. In his role, he serves as a national resource to assist members in defending against cyber attacks and other threats to their organizations. Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Petterly with AHA Communications. In this podcast, we have the opportunity to talk to leaders of two AHA member hospitals who were victims of major ransomware attacks in the fall of 2020. Adrienne Chase, Corporate Compliance and Risk Officer, and Mandy Shelast, Vice President of Physician Services and Clinical Networks, join us from Dickinson County Healthcare System in Iron Mountain, Michigan. John Gaede, Director of Information Services, and Ronald Woita, Chief Nursing Officer and Vice President of Patient Care Services, join us from Sky Lakes Medical Center in Klamath Falls, Oregon. John Riggi previously interviewed them about lessons learned and best practices during the attack, which they are willing to share on today's podcast. Now here's John to give the proper introductions.
Thank you, Tom. Hello, everyone. This is John Riggi from the American Hospital Association, your Senior Advisor for Cybersecurity and Risk. Thanks for joining us again for another episode in our continuing Cyber and Risk podcast series, Frontline Perspective. In this series, we feature highly accomplished leaders from the healthcare field, cybersecurity industry, and government. Today's episode is truly unique and is truly a frontline perspective. Today, we have the rare opportunity to speak with four information security and clinical leaders of not one, but two hospital and healthcare organizations which became victims of high-impact ransomware attacks in October 2020. The attacks against these organizations and other hospitals and health systems led the FBI, Department of Homeland Security, and Health and Human Services issue an urgent warning that foreign-based ransomware gangs were targeting U.S. hospitals and healthcare. Their despicable goal was to conduct highly disruptive ransomware attacks, which would interrupt care delivery and pose a risk to patient safety. So to discuss their perspectives, I'm pleased and privileged to have with me today my friends and colleagues from both organizations. First, we have Adrienne Chase, Corporate Compliance and Risk Officer from Dickinson County Health System. She has over a decade experience in the field. Also with Adrienne from Dickinson County Health System, we have Mandy Shelast. Mandy has over 12 years of experience in rural health, critical access hospital, medical group, and PPS hospital experience. Also with me today, we have John Gaede, Director of Information Systems at Sky Lakes Medical Center in Oregon. John has about 20 years of healthcare IT experience in both community hospitals and large academic health systems. Also today, from Sky Lakes, we have Ron Woita. He's the Chief Nursing Officer and Vice President of Patient Care Services. Ron has been in nursing for 23 years at critical access hospitals, community, and large hospitals. Ron has been at Sky Lakes for over 10 years as the Nursing Director of Emergency Services as well. So Adrienne, let's start with you. How did you first become aware of the attack targeting Dickinson County, and what were the major impacts, and what were your priority actions?
Thank you, John Riggi, for having us a part of this podcast. I was 5 weeks into my role here at Dickinson when we were attacked with a ransomware incident. It was on a Saturday morning, crisp fall morning, and I was actually looking for property in the remote area of Michigan. And I got a call from our IT director that said, Adrienne, all systems are down. And so when I received the call and confirmed that it was a ransomware attack, my stomach dropped. And I immediately invoked, obviously, my response, the incident response team. We were able to get our insurance broker available on the call immediately. and we were able to get a whole team on a Saturday morning ready and willing to go. And you can imagine on a Saturday morning in October, it's hard to get staff just to come in. So we had a whole team that we were able to get together. So some of the major impacts that hit us, we had over 1,200 endpoint devices. We have about 700 employees. So we had some challenges with the communication with those staff members and getting everybody on the same board as far as what happened. And we had about 400 to 500 applications that were affected. So we were impacted by patient care, obviously. We weren't able to do some of our service lines like imaging. So it took us about 7 days to get back up and a total of 11 weeks to get back fully. So the priority actions for us at Dickinson here was patient care comes first. We performed a risk matrix and our business continuity plans immediately that day. And we worked about 20 hours a day, round the clock. And we had an incident command team that met 3 times a day. So those were some of the priority actions that we had and some of the major impacts.
Thanks, Adrienne. And John, let me go over to you. I know you had a pretty significant attack right off the bat. You had significant impact. From your perspective, could you tell us what the impact and your actions were?
Yeah, so very similar to what Adrienne answered. I'll just share our attack happened. We got notified in information services on Tuesday morning at 1:30 a.m. And the symptom was system slowness. The day prior at noon, an employee had received an email and clicked on that email offering a bonus. And within 30 minutes, went out to what's called the 0-day site, a site that nobody knows is used by bad actors, downloaded a payload onto the machine, and that caused encryption to begin in our system. So a phone call comes in the next morning at 1:30 a.m. To one of our engineers. He receives that call. Takes us a couple hours to really understand what's happened, and we end up finding a file on one of our servers that says that it's Ryuk ransomware. So from there, the major impacts that resulted from that was we ended up having to turn off every system in our hospital. So that's every computer, every server. So for us, that's about 650 servers, 150 different applications, including every system, financial, clinical, operational system, facility services systems, everything goes completely offline. And so at Sky Lakes, we immediately went into our downtime procedures, which we had well-written policies and procedures that have been developed over years. And so we activated those, and we got those processes going. But we quickly learned the impact, and I'm going to steal a line from Ron Woita, our VP of Patient Care Services. We quickly learned that we had worked downtime out of the processes. We no longer had the number of people that we needed to work in a fully offline mode. So after about 48 hours, those processes broke down pretty quickly and created this level of stress in the environment for our clinical staff, physicians, nurses, respiratory therapists. It put us in a situation that was more than challenging. And then for context, and I'm sure the same was for Adrienne, this was when we were seeing our first wave of COVID. So on top of the first challenges as organizations that we were dealing with COVID, we now have all of our systems offline. So some of the priority actions we did, the first thing was we shut down every system from an IT perspective. We started a command center structure that we have. We have a daily huddle at the hospital where we use that as the entry point to let everybody know what was happening and to talk about next steps. Kind of operationally, what we did was when our engineer realized that this was ransomware, there was just this standard escalation. So the manager was notified, the manager notified me, then I notified our senior leadership team as well that we had been hit with ransomware. So that was kind of some of the pathway that we went through.
Yeah, thanks for that, John. You mentioned a couple of points there that I'm seeing across the board here and across the nation, unfortunately, when I deal with victims of ransomware attacks. The reliance on technology, although a great thing to improve patient outcomes, to improve efficiency, also does create an over-reliance there. And when those systems aren't working, Often organizations are unprepared. The staff are unprepared to go to manual procedures, as you said. And Ryuk, as you mentioned, dangerous, very dangerous strain of ransomware, specifically targeting hospitals to cause that disruption, as I spoke about. Mandy, from your perspective, let's go over to the clinical side a bit. Mandy, what was some of the, how did you become aware initially of the attack, the impacts in your actions?
Thank you, John. So, ironically, the day of the attack was my fifth day of employment with this organization. So, I had just met the team. I had 150 clinicians, nurses, frontline caregivers on my team, and many of them I had not met. They had not met me. They didn't have my phone number. So, I received the call from Adrienne to let me know what was going on. And I can honestly say that when I heard this, I did not understand how bad this actually was for our organization. The first thing that I did was figure out where our emergency call list was and make sure that we started to get a hold of our clinicians and our caregivers and those key leaders so that we could be ready and able to give patient care on Monday. We are one of the only hospitals in a couple 100-mile radius to care for our communities, and we knew that we had to be there for them. So we needed to get into our downtime procedures. And, as John mentioned, we were a little rusty in that. Certainly, we could go down for a couple hours, maybe a day. We were used to that. We had paper forms and people felt pretty comfortable with those items. But one of the things with my area in the clinics was we were down for 8 weeks. It was one of the systems that was down the longest. And imagine asking a physician to document on paper for 8 weeks. So that was certainly very interesting, but definitely getting a hold of that emergency contact list, recognizing that we probably needed to update that a little bit more frequently because in fact, I wasn't even on the emergency contact list as I just arrived at the organization. So our number one item was to care for our patients on Monday, and we did everything that we could to be sure that we would be able to do that.
Thanks, Mandy. Couple of key points. Again, I think for us to really focus in on call out schedule, probably not updated as well as it could have been, and maybe not in paper form. Again, if it's electronic and all your systems are down, I see that as a problem for a lot of organizations. They have the plans, but they're all electronic. And then when you don't have access to that, you don't have the plan. And one other point too, Mandy, you mentioned, I think is really significant. The only care provider within 200 miles, I think you mentioned, the only hospital within 200 miles. That's amazing. And folks don't realize the danger these attacks place the community in because there is no ED. And whenever there's a delay in urgent care, because you have to transfer patients potentially or divert ambulances, that increases the delay, which increases the risk of a negative outcome tremendously. That's why I always tell all my former colleagues at the FBI and in government, hey, you attack a hospital with ransomware, that's not an economic crime, that's a threat to life crime. So Ron, with that, let me get back to you now from Sky Lakes. What is some of the clinical impact that you experienced?
Morning of the attack, we'd actually just finished up a late night of union negotiations the previous day. And so many of the nursing leaders had been out of the office and actually had missed the daily huddle. So actually, when I arrived to the hospital, some of my staff were like, yeah, we had some printing issues again last night, which are just periodic things that happen, and staff adjust, accommodate, and continue to deliver great patient care. The question that came up though was, well, how long do you think this is going to last? And so the perception at that point was that, yeah, it's going to be down for a couple of hours, maybe to the end of the day. So we started down those downtime pathways. We brought out the grease board. At this time, I was the director of the emergency services. And so I was focused in on cath lab and ambulatory care and the ED and trying to make sure that they were up and running. One of the big discoveries that we found once we had to shut down all systems was we didn't have a call tree. And so essentially what we built in the mid-morning to late afternoon was a cell phone call tree that we could communicate back and forth and ask for help and call staff in. But we weren't aware of what was really going on behind the scenes in the IS world, IT worlds. We were just trying to deliver great patient care. We cover a area of about 10,000 square miles. And so it can be up to an hour and a half on an ambulance to get to our hospital. That was something that we found very early on in the process is because we didn't have all of our connecting numbers to our transfer facilities. So we had to try and find pathways of communication to even transfer patients out. As it all started, it was kind of surreal. We just thought we were in this kind of blip and it'll be fixed by the end of the day, maybe this evening. It wasn't until later in the afternoon, from a clinical standpoint, where we found out, hey, this is going to be long term, and we need to start preparing for the next shifts, the next day, potentially the next week. And that brought a sense of fear in because clinical staff were geared to do the downtimes and working through those processes. But what we didn't know was the extent to how we had to educate staff, how we had to make sure nurses knew how to write paper orders, how our new doctors, our residents, they had to actually bring a paper order to you and say, how do I fill this out? Because they had never done it. It all had been electronic. As we continue to go through this process of continual improvement, we have worked those downtime procedures out of that system.
Thanks, Ron. Yeah, pretty sobering, right, to understand what the impact is and clinical impact of one of these attacks. A lot of the impact that you mentioned revolved around other systems besides the electronic medical record as well. So you had loss of other medical technology, which had an immediate impact. And some of the victims I've spoken to, they said they were more concerned with, for instance, loss of telemetry, loss of labs and the PACS imaging systems, and the inability to communicate with staff members just to get that staffing surge in, as you mentioned. So major impact across the board. John, back to you. So what were some of the impacts which surprised you, and what do you think some of the key lessons learned were? I know we could go on for hours actually on this. And really, one last thing, if you could give our listeners one piece of advice, knowing what you know now, what would that be?
John, thank you. I think the most surprising impact to me was I've been in healthcare IT for about 20 years, and our default go-to downtime is fax. We're going to fax. And we found out that your orders and results between lab and your intensive care unit or your med-surg unit or the emergency department, pharmacy, faxing broke down. And we didn't have enough fax machines, and faxing, that technology is really slow. So the impact was stat labs were no longer an hour or 2 hours. They were taking 4 or 8 hours. And we ended up finding out we had to have people actually sneakering the results between the ED and the laboratory because the fax process just broke down. And that was a core part of our downtime process. And it was because the downtime was extended. For us, it ended up being 23 days offline for our EMR. The second thing I would say that was really surprising, and I'd say this is probably a key takeaway, was we were instructed that this would be a marathon and a marathon of marathons. When you're asked to completely rebuild your network, your infrastructure, Active Directory, which manages all of your users, and that's been built out over 15 years or so, and you have to completely rebuild that from the ground up. You have to completely rebuild your servers and restore. And we were very thankful. We had an excellent backup solution that allowed us to fully recover and not pay a ransom. But this was a marathon. So the IT team, we were going to stay at the hospital until we had had taken care of our clinicians, till Ron could do the business that he needed to do in the ED to take care of our patients. And wisely, some of the recovery teams that came in alongside us said, no, you guys need to go home and get a few hours of sleep tonight because you're going to be here doing this for 22 hours tomorrow. And so we learned that it wasn't just a marathon, it was a marathon of marathons for the recovery. And just to put some context on that, for us to do all the back entry that we did for the organization, because your labs, your allergies, medications, those all have to be discreetly put back into the EMR. That back entry process took us about 7 months to fully recover.
Yeah, that's pretty amazing, John. All that you went through there. Again, a couple of key points that you mentioned that folks don't often plan for is the loss of this ancillary technology, which becomes critical during the crisis. Your fax machines, the Active Directory. We hear a lot about this, that the extensive efforts that are needed to rebuild that as it took you guys. When I'm advising all of the hospitals that I deal with, the exercise and preparation, the incident response plans, downtime procedures have to be planned for 3 to 4 weeks minimum just for mission critical systems. And I can tell you very, very few organizations practice that these days because previously there wasn't the need for it, right? You had a cyber incident, it was resolved, it was exfiltration of data and so forth. Marathon of marathons, I like that phrase. think that summarizes it quite a bit. And on the business side, the only other commentary I would make is that back entry of data, not only is that a logistical and a paper issue, it's a revenue issue, it's a business issue. So there's a tremendous interruption in revenue cycle. And what we're finding is a loss of revenue due to incomplete documentation during this time. You've got the crisis of a ransomware attack, and you're dealing with the crisis of COVID. I mean, just incredible situation. Adrienne, let me go over to you for some of your, again, surprises, key lessons learned, and piece of advice for our listeners.
Thank you, John. I think the two things that hit me the most were communication and trust. And I think the marathon concept is great that John had mentioned, that this truly is a marathon. And you're running that marathon in a crime scene, because when someone attacks your network, they encrypt it, they try to exfiltrate your data, and then they try to extort you. During that marathon, you're trying to deal with a crime scene and you're trying to deliver safe patient care, because we're all in the healthcare business. And the listeners today have probably did some tabletop exercises. They've probably been in some sort of aspect of tabletop exercises. And so I think the one thing that surprised me is that I practiced for 10 years doing those tabletop exercises, and nothing can prepare you for literally the dark zone, because when you're walking through the halls and your monitors don't work, your TV screens, your phones don't work, because your phones, they're integrated into the network. Our fax machines weren't working. We had to literally go and print our memos at a print shop in town because we couldn't even print. When John said you literally have to clean everything because it's a crime scene, with the crime scene, they're collecting evidence and artifacts as you're still trying to deliver safe patient care. The two things that consistently stand out to me is communication and trust with the community, with our patients, and most importantly, with our employees, because we need our employees to treat these patients and continue services. So one piece of advice that I would give the listeners today is just make sure that you take care of your employees. If you do have an incident like this and you practice these incidents and you have good communication and trust with your employees. One of the things that we didn't think about was payroll and making sure that we can pay our people, because we can deliver patient care, but we need to pay our people and take care of our people. We're running a marathon. Sometimes some of us are working 20 hours a day to do this. So to practice, I think, will make you perfect in making sure that you bring this topic to your emergency preparedness group and actually have a code for cyber events. The two things that I would say that were key takeaways for me is strong communication and trust.
Thanks, Adrienne. I think those were very, very wise words, again, from somebody that's been through it. And when I do tabletops now, we, quite frankly, the electronic medical record's almost ancillary. We focus on all these other issues, as you said, including payroll. So I've been dealt with victims who their timekeeping systems are down. They can't figure out who's in there. But ultimately, we've got to pay our staff. Just like you said, they're already suffering under enormous stress of dealing with COVID patients, and then to deal with this. And we have a lot of folks that live paycheck to paycheck. They need those checks to come in. Ron, from your side on the clinical piece there, could you tell us again some of the impacts that surprised you, key lessons learned, and any advice you could give to our listeners?
The overarching topic really is the depth of the impact of the downtime. From a clinical standpoint, we didn't understand how the impact of all the way down to the tube system, right? The tube system that takes the labs from the emergency department to the lab so they can be processed. Taking that out of operation requires 2 to 3 additional people just to make sure that the labs can get there in a timely fashion so that we can get that important information back to deliver that safe patient care. The other thing is practicing. You know, we have the monthly downtimes with Epic, and we've worked through some of the different downtimes, but I don't think we prepared for a total downtime. I don't think we were prepared for all systems being down, and to the point where clinical staff didn't even understand what that impact was, all the way down to patient labels. We actually had to design patient labels on an Excel spreadsheet and hook it up to a local printer so we could at least safely label patient labs, belongings, medications. And even that piece was so stressful to staff. I just take that away as the small things become much larger in these situations. And it's those little things that cause the most stress because clinicians want to deliver safe patient care. They want to follow the rules. They want to follow the red rules to make sure they're appropriately labeling labs and giving the right medications. And so by being prepared for those little things, I think you set your team up for success to care for not only the patients, but for your staff.
Thanks, Ron. And really some key lessons that you learned there, which I don't think people focus on, as you said, just being able to have an alternate means to print labels for the labs, the meds, patient wristbands. Everyone practices downtime focused on the EMR and charting, but it's all these ancillary things that, again, organizations aren't prepared for and could introduce significant risk if not done properly. So thanks for those comments, Ron. Mandy, perhaps some final words from you, again, on what surprised you, key lessons learned, and any advice for our listeners.
Sure. So some of the things that surprised me, I think, are just the healthcare system's overall reliance on technology and how comfortable physicians and nurses and reception team members get with that. And when it's not there anymore, it becomes a very uncomfortable environment. So not only do they not know what patients may be coming in that they'll be caring for that day, but some of the physicians that were at our organization had never documented on paper charts. They'd never used a paper lab form. They didn't know what to do to get that to the next person in the chain so that that patient could get the care that they needed. The thing that surprised me was this is something that you prepare for. This is something that you learn about and you hear about it. You don't think it'll happen to you. And you never really talk with your staff about downtime procedures outside of a day. You can always make it through that, but how are you going to make sure that you can coordinate care? How do you get referrals from outside places when your fax machines are down? Those are all things that were very surprising. I think one of the other things was we didn't know who was coming in on our schedules, and we had made the decision to care for our patients regardless of if they had insurance, because we didn't know, we couldn't check that, or if there was a prior authorization for a service that we were giving. And we had not even considered that we could be in a scenario that was like that. So I know people will talk about cybersecurity attacks kind of like a tornado. They go through and the event concludes, but you are literally rebuilding your healthcare system, your patient records for, months after that. So it was certainly surprising to me. If I could give the listeners one piece of advice, I think it would be it's okay to talk about this. If you've been through this, go out and share. Go out and tell people the things that you never thought might happen. When you do tabletop exercises, really think about the impacts to your team, to your staff members, not only on patient care, but also that moral well-being. How do you keep your staff resilient, not only through a pandemic like we went through, but also through the cybersecurity attack? So my advice, it's okay to talk about it and prepare.
Mandy, thank you for that. Truly great advice. I like your analogy, like a tornado. We get forecasts all the time, approaching weather systems, natural disasters. You get some warning. You can plan for it, and it concludes. Ransomware attacks are like this rolling disaster that the ramifications you experience in a marathon-like way for weeks and months. And unlike a tornado or other natural disaster, in a cyber or ransomware attack, the adversary is actually changing course based upon what you do. He's trying to evade your countermeasures that you put in place. So tremendously valuable lessons that you all shared with us today. Again, thank you for doing this. You're helping make the entire field safer. And again, I want to thank you individually, all of you and individually too, for what you're doing to help defend the networks of your organizations in healthcare and what you have done and continue to do to provide patient care during the pandemic. Thank you to all of you, your staff. And this has been John Riggi, your Senior Advisor for Cybersecurity and Risk. Stay safe, everyone.